Welcome back to the OHSU Effect Inside Health and Science at OHSU. Some remarkable work is going on at OHSU regarding new imaging technology, things like X-rays and MRIs. To talk about all of this is Dr. Jeffrey Pollock, a neuroradiologist. Hi, doctor.
Good morning.
Okay, first things first, what is a neuroradiologist?
A neuroradiologist is someone who specializes in imaging of the brain, spine, and head and neck. So all I do is basically look at pictures of those areas.
Okay, so we're here to talk about medical imaging in general, so that includes MRIs and X-rays. How far have these technologies advanced?
Things in the last few years have really been driven by the computer technology, both on the imaging acquisition level as well as the interpretation level. Things are digital now, whereas in the old days, everything was films, like photographs. But now everything is done with computers and computer monitors. And the real advances have been in speed and resolution, and as well as 3D imaging.
Yeah, I will say I had to have some X-rays recently, and it was fast. And it was to my doctor, to the technician, in instant time.
So that was very quick exam nowadays.
We hear sometimes about exploratory surgery. So do newer imaging technologies make those surgeries obsolete now?
In the emergent setting, some of those surgeries are not necessary anymore as compared to the old days, but there are still certain situations where that exploratory surgery is needed, but certainly less so than the old days. The surgeries are also less invasive nowadays because we're able to pinpoint where people actually need to go for surgery or what actually needs to be done ahead of time. So not so much exploratory as less invasive.
Could you give an example of one of those surgeries that may not be needed thanks to an MRI or an X-ray?
Well, in the days before CT and MRI, if someone had some bleeding in their abdomen, they would have to basically cut them open to see what was bleeding, for example. And that was obviously a pretty big surgery. And nowadays we can scan them and find out what's bleeding ahead of time so they will actually know, for example, what they have to fix.
Wow. So what other kinds of things can you see using today's imaging technology?
The imaging has advanced to the point where we're down to where we can actually see things less than a millimeter in size, which is pretty astounding. And also we're getting to the point where we can see things that are moving. So things like your heart that's beating, we can actually take a picture of it and essentially freeze it like a photograph.
Wow. What is the future of medical imaging and where do you think it's headed?
It's going to be fascinating in the next few years. Things are heading in the direction of going faster with higher resolutions. We're also heading in the realm of physiology and metabolism. And so we're not just taking sort of pictures of, static pictures. They're much more dynamic. And we're also incorporating more personalized medicine so that the medicine is actually tailored to the individual's medical needs more so.
So you can take a picture of someone's metabolism?
We can. We actually can. So we can, in neuroimaging, we can do imaging of the brain to see where you're thinking. So while you're actually doing tasks or talking or thinking or listening, we can actually see which parts of the brain are active during those tasks and map those out.
Wow. So, sometimes it appears that all the machines do all the work, but like you said, you are the one who reads those pictures every day. So how important are people like you and the people taking the pictures?
Imaging in radiology is analogous to photography. And so for photography, you need three things. You need a good subject, which is the patient who needs to hold still. And then you need a good photographer as well, someone with a steady hand to take the good pictures. And then you need an artist, which is my job at the end, to actually interpret the image. And all three of those are sort of important. But it is essential to have a good photographer. And we have some really great ones at OHSU.
There are a lot of fears associated with imaging. Some people are worried about radiation when they get X-rays. What things should people be worried about, if anything?
We've gone to pretty far lengths to actually reduce the amount of X-ray exposure and radiation exposure in general. The first thing we do is we protocol the exams, and so we decide what body part's being imaged and whether it's actually relevant to the patient's clinical scenario. So in some situations, we might recommend a different test or a different modality that doesn't have X-rays. If it is indicated, we then will reduce the amount of area that's actually scanned, so again, reducing the amount of dose that you get. And then lastly, we use the lowest dose possible to generate good quality images, and that's really the three hallmarks of reducing radiation exposure.
And what about MRIs? People sometimes get really claustrophobic if they know they're going to have an MRI.
MRI, we have sort of two options or three options, really. On the equipment side, you have the open MRIs nowadays, which are completely open on the sides. We also have a new magnet, which is a wider bore, which means that the sort of you're inside of a donut, and so the whole of the donut's just bigger around. And so for some people, it's a lot more comfortable. I've been inside it, and it's actually a lot more roomy than the old magnets used to be. And then, two, we also try and do things like have music and entertainment while people are actually in the magnet to distract them.
Yeah, can people listen to their iPods or anything like that?
Not your iPod, but if you have a radio station you like, we can actually play it for you.
Wow, that's great. So can anyone come to your clinic for x-rays, or do they need to be referred by your doctor, or how does that work?
Most patients are referred by their ordering physicians. Occasionally, people will come in directly.
Well, Dr. Pollock, thank you so much for all the information.
Well, thank you.
That's the OHSU Effect Inside Health and Science at OHSU.